big headline from the Conservative manifesto: 50,000 more nurses on our overstretched hospital wards. Bursaries for nurse training will be brought back, but the funding for it has already been questioned.
And one of the things that we can do with this new package is not just have the bursaries for nurses and people who want to become nurses, but also have the places, the training places in universities, in hospitals, and the apprenticeships that we want to use to recruit. So it's more than just the bursary, it's also about having those training places available.
Opposition parties claim the numbers don't add up. Labour's Shadow Health Secretary, Jonathan Ashworth, says the pledge is frankly deceitful. And the Lib Dems' Luciana Berger called the figures insulting to the public. So what's the argument about? Of the 50,000 promised nurses, 14,000 will be new graduates and undergraduates coming into the system. Grants for trainee nurses, which were scrapped in 2017 by the Conservatives, will be partially reinstated, a U-turn by the government after the move led to a drop in nursing applications. But their tuition fees are not all covered. A further 12,500 nurses will be recruited from abroad through a new NHS visa. And it's hoped that around a third of the total, 18,500, will be existing nurses, either staying in the profession or returning to it because of improved career opportunities.
A few years ago, the current government removed the nursing bursary, which meant we saw a really significant decrease in the number of applicants coming into nursing. What the pledge that they're making for should they get into government next time, it goes some way to replacing half of what they took away.
How are you doing? You're right.
And those criticisms were quickly jumped on by the opposition, who say new nurses will have to be found elsewhere.
Well, since they're a party that's presided over 40,000 nurse vacancies in the NHS, who 3 years ago said they were going to put more doctors in the NHS, and there are now 6,500 less doctors or vacancies of doctors in the NHS. They haven't put the money into nurse bursaries, they haven't put the money into education and training. They are simply proved they're unable to do it.
Boris Johnson was all smiles as he launched his manifesto, claiming delivering Brexit would allow the government to focus on public services like the NHS. But can big figure promises translate into action?